Good afternoon, I'm Paul Milne, the current CEO of Fearless PTSD Australia New Zealand. Welcome to our webinar today on leadership and mental health and wellbeing. This is a great topic. It's obviously a conversation starter to get things going at the moment in our current environment. Before I start, I'm currently on Wurundjeri land today in Melbourne, and Fearless PTSD Australia New Zealand recognises the first peoples of this nation and their ongoing connection to culture and country. We acknowledge First Nation peoples as traditional owners and custodians of the world's oldest living culture and pay respects to the elders past, present and emerging. So discussing leadership in mental health and wellbeing, the topic was nobody cares how much you know until they know how much you care. It's a great topic to discuss on what we think of leadership in mental health, how we can change the conversation and emphasising the language and strategies to change leadership. I'd also like to welcome two of the panellists today who are both authors. I'll start with Esther. Welcome, Esther McKay.
Thanks, Paul.
Esther's done 17 years in the New South Wales Police Force, attaining the rank of detective, specialised in forensic services for 15 years. She was awarded the National Police Service Medal and a 15-year class for the Pride of Australia Medal for community service, and New South Wales Diligent and Ethical Service Medal and the National Service Medal. So welcome, Esther. Welcome today. Also present is Grant Edwards, APM. Grant is a successful author. He has Masters in Leadership, Policy and Governance Studies. He's just written a new book on Protecting the Protectors, which is a great book on leadership and mental health. And obviously today we're going to discuss how we can change leadership at the moment. I also would like to say, if anyone's triggered by anything that we're discussing today, please take some time out. And if you need any further assistance, please seek some professional help. Hopefully we won't trigger anyone today. So as I said, we're going to start having a discussion about redefining leadership roles to integrate mental health and wellbeing strategies effectively. So I'm just going to pass this one off to Grant first and see what he thinks on this subject. Thank you.
Thanks, Paul, and welcome everyone. Thanks for viewing. Paul's absolutely right. This is it's a vexed topic what we're going to talk about today, because if you were to search across the internet or search across academia, there is virtually nothing that exists with regard to specifically leadership and in mental health. And that's quite disturbing when you figure that, the number of people that are in the workforce and what we're going to talk about today, by the way, applies across the board, not to any one particular profession or occupation. But there's very little by way of leadership in this space. And given the fact that mental health is so prominent these days, it's surprising to me that nothing or very little has taken place in this regard. When you figure, when you look at the statistics, and when we talk about the mental health, we talk about everything, from anxiety right the way through the actual scope of mental health to the really serious issues of bipolar, etc. I myself have been diagnosed with post-traumatic stress injury, so I've lived it, and what I think we need to do is to start, for instance, with conversations about this, but it's also about encouraging not only individuals who are leaders, and when I use the word leader, I don't define it as a boss or an executive or a CEO or whatever it may be, because really leadership starts with the self. So everybody has a role in that, whether it's in your household, whether it's in your workplace, it's a sporting organisation, whatever. Because as we've seen, especially on the back of COVID, the mental health issues, not only in our country, but across the world, are exponentially increasing. And the statistics prove that.
Yeah, definitely. Yeah, and it's obviously how do we change leadership and how they look at mental health? What do we need to do to put systems in place? Like obviously policies and procedures are all designed to cover certain organisations of what they need to do for their people. But at the moment, people are just not having that trust, and they don't believe leaders are empathetic towards them and understanding of what they're actually going through. So, and just treating people like numbers now. So,
well, that's right. I mean, you look at the traditional leadership models, and they're very much focused on outputs. They're focused on things like KPIs, thinking about, growing the business or growing the organisation, meeting the expectations of stakeholders, meeting the expectation of funders or of government or whoever it may be. And that's fine. That needs to remain a part. But we have to change the philosophy, because without the people, we don't achieve the outcomes. And it's very easy to cast people aside, because in many there's an attitude of, well, we can just replace them. But there's a financial cost to that. So if I were going to sum it up, I would have to say, in true leadership, people matter. We've got to put people first.
Yeah. I was just going to say, Esther, like we always say, like we lead by example. And at the moment, we're not seeing in leadership that people are leading by example. And leadership, sometimes they fall down and obviously not being mindful of their own mental health. So we can obviously implement that our leadership look after their own mental health and show by example. I think we'll get a lot more people following that example.
I agree. I think this is where there is a lot of work to be done, because leaders come into roles with really, high level of qualifications and, come into the role being able to commit to what they need to do. But education around the mental health and how to actually steer their staff in the right direction and how to address things is something that's really missing. And we're seeing it across the board. And one of the areas I can see is just such a simple change that could be implemented is when we're doing these performance reviews, just when staffing are pulled in, asking them what's happening with you, what's happening in your world, rather than saying what's wrong with you, especially if their performance is actually starting to slip, because that's usually the first sign where something's not quite right, when you've got really high achievers or people that are really working well in a team, and then all of a sudden you start to see a little bit, that something's not quite right. And if that's let go for too long, then it's really hard to get that back. And the more that the person's suffering and the more that they start to feel the stigma around how do I find help, how do I actually breach the subject, the more difficult it is to bring them back. And that's where there's a real problem with, we've got a problem throughout Australia across our nation's police and probably other organisations equally with retaining staff. And you hear it time and time again that people leave because there isn't leadership in regards to that balance between work-life balance. And people need that now. I mean, to be healthy and well at work, you need a good life-work balance.
Yeah, definitely. And I think that the people that they're trying to get into these roles now, if we talk about attrition rates, people's mindsets have changed. They take in consideration their mental health now, and they want to be looked after, and they want to go into organisations with trust that their mental health will be looked after and they can count on people. And going back, for 20, 30 years, the old police veteran, there was no concern about mental health back then. We didn't know it. We didn't understand it. But now the people we're trying to get into these roles to fill our emergency services and other sectors, they all care about it. And it's important to them. It's like one of their number one priorities, their mental health. Because obviously once that falls down, everything else starts to fall down.
I agree. And we've seen traditionally, and we know that the rates of suicide is far higher in former members of services than it is from those serving. And so there's obviously a gap there where we start to look at what's going wrong here and why are we letting this just fester and get worse until the point where the person themselves just can't stay in the role anymore. And we also see that in the workers' comp. It's astronomical, the amounts of workers' comp that's going on in regards to people that are, if it was picked up earlier by managers that understood and had good training. And I'm not criticising managers for not having the training, because this is where we need to go back a step further and look at implementing this training before people start to get into roles where they've got that as a priority with looking after staff.
Well, I think the key is prevention. As you said, it's like getting it from the recruit stage to get people understanding better. And then obviously, because our recruits will end up becoming leaders one day. So if they've got that instilled that knowledge from an early start, so when they become into leadership, they've already got it there. They already know how to self-care, they know how to look after themselves, and they can promote that to, their subordinates. So it's very important.
Yes, it's what Grant was saying about the data and looking at figures and KPIs. There needs to be a shift away from that. Yes, it's extremely important, and we've got to focus on that. We've got to have good productivity.
Yeah.
But if we don't look after people that are starting to go under because of pressure, and the more that others are going under, then you've got less staff and more pressure, workload, exhaustion, all these things. It's a matter of actually really looking at the balance and getting it right, and not just looking at the data against our people, trying to get a balance in between the two.
Yeah. I find that we work very well in the negative and not the positive. As you say, it's like if we start working in that positive side, I think it's going to change the culture of organisations a lot more. Because always, as I said, we always focus on that negativity, and if we can change that mindset, I think it's going to help us in a long way in how to do things.
I agree. I do. I really agree with that. And I think too that there's so many aspects to this, and trying to implement change is really difficult because hierarchical style organisations that are military style, that have that the way that they run their teams in that sort of hierarchical state, very hard to put in changes. So it has to be step by step and just small steps at a time to try and just put some small changes in, and then evaluate it, have a look at it, see whether it's actually assisting, whether it's changing things. And I think keeping data on evaluating where we're changing things and seeing whether that's actually improving things for staff and helping with mental health is probably the key, so that you can actually work on it slowly.
Yeah, exactly. And the majority of emergency services, their workforces, 10% of them are almost on workers' compensation. I found out today that there's 116 in the Northern Territory, and 92% are related to mental health issues.
Yeah.
52%.
Yeah.
So obviously we're not doing the right things at the moment, and obviously it needs to change in leadership.
Yeah, well, that's why I think it's going to start.
Yeah.
The leaders are the ones that can make change. So they're the ones that have actually got to, put themselves forward and say this is not good enough. And we want education, we want change, we want to try new initiatives. We want to see how we go with this and see whether we can actually implement some. I mean, it's no use keep doing it the same way that we've always done it when it's not working. That's the bottom line.
I agree totally with you. And as I said, like it's in every sector, like it's in mining, it's in corporate, the same issues still keep popping up. And obviously we really need to address how we address leadership in this area.
Yeah. And that's right, Paul. You look across the sectors and you mentioned mining, construction, medical, doctors, nurses, vets, vets have a huge suicide rate. And we're talking about, suicide, depression, stress. And we also need to move away from segregating the workplace to the personal life, because they're linked. And I don't know how many times, throughout my career, I heard, that person, there was issues at home that caused this. And it's too easy for organisations and leaders to segregate that. And when you consider during your work life, you spend more time at work than you do at home. The only other place you spend more time is, if you've got a good sleep hygiene, is sleeping. So it's important that we recognise that, and we also important that we recognise the impact that has on family. And I mean, let's face it, life's stressful enough as it is. Mortgages. You look at the cost of living that's happening now. Ill family, aging parents, all those kind of things build. And if you don't have a mentally safe workplace, well, that's going to add to the stress. And eventually there's no more water in the jug. It flows over, and we need to move away from that. And that's the language component, where we start to look at the holistic program as opposed to just look at it individually or siloed.
Yeah. And as I said, like not one recovery works for everyone else. Like everyone is built differently. We all understand things differently. We learn things differently. So we need to be able to adapt how we teach people on how we look at things. And as I was saying to you earlier today, I looked up the leadership charters of a lot of organisations in Australia, and not one of them mentions mental health as part of their leadership charter. And obviously we're trying to get this into the DNA of organisations to start looking after their people a lot better and understanding a language that people understand, and there's empathy and understanding towards people. But if we can't do it from the critical point of their leadership charter, which everyone follows policies and procedures, they're all put in place and everyone, this is what we must follow. If we're not leading from example from the start, how are people going to follow?
I think that's also important, the subject about family as well, you know,
Yeah.
giving families some education, because over my time working with serving and former police, I've had a lot of discussions with family members who just didn't really understand what was happening to their partner, and the children also get quite well affected by it as well. And you know, vicarious trauma is really endemic in families, especially the kids that are seeing a parent that's really struggling. So education and bringing it into a holistic, you know, so that everybody's understanding what's going on, and educating family members how to support their partner, that the one that's actually serving and that's really finding it difficult. But bringing them together, you know, bringing them together and doing, you know, family days and
Yeah.
yeah, just opening the conversation so that families can actually get some understanding about how does this happen, what is happening, what can I do to support, and what are the avenues to actually get the support.
Yeah, yeah. Because I think, as I said, like, people focus on the person who's actually going through the mental health problem, but not the family or the children. And I can speak from my own personal experience that no one ever checked up on my kids or my family on how they were dealing with me when I was going through it. So I was lucky I had a family, but if you're a single person going through this issue, who do you fall back on? Because your friends, you know, they're going to struggle as well to understand exactly what's going on. So we need to get the systems in place right from the start.
They're the concerning ones. Actually, the people that don't have a support network at home are far more likely to consider harming themselves. I had an example when I was working at Police Legacy Backup for Life, where a commander actually rang me and said that he had an officer who he had to deliver a 181D to, which is a show cause why you shouldn't be sacked. But
Yeah.
this officer had been off for quite some time. It was sort of a bit of a workplace bullying, mental health type thing that hadn't been addressed. And it could have been addressed at a much earlier state, and it probably would have been sorted out, but it wasn't. And he was concerned that if he went around there on his own wearing the uniform, and she was already very stressed about her workplace, by delivering that message to her, that she may consider harming herself, or you know, it could have been really catastrophic. So, I mean, I suggested that he take a police chaplain with him, so that the chaplain could be the conduit between him and the police service, or the police force, as far as there is someone there to support you. There's someone here delivering this message, which is very difficult to hear and you know, quite devastating for the officer. But on the other hand, there's a chaplain there to provide that support. There's little things like this that we could tweak, and you know, we talk about policy. There's no policy around these type of things, and commanders that get asked to do these duties, they don't have any training, mostly, on how to deliver a message like that, which could mean the end of someone's career. So, you know, it's just little things like that that we could probably tweak and change and give some support to those people that are in the leadership roles that have to deal with people and show empathy. Not everyone's got empathy. Not everyone's born with it. Some people can learn it. Some people have got it. But giving them even a script of what to follow would be helpful.
Yeah, and it's right. It's just getting that investment in that learning to train people up in dealing with those certain situations. As you know, a lot of people get promoted into leadership roles, but they're not actually trained in this area.
No.
And they're still trying to find their way through being a leader and how they're supposed to, you know, control people and manage people and, you know, look after the organisation. But they're forgetting on how to actually look after their own people and having that empathy, as you said, to understand where people are coming from. As I said, some people are born with it and some people got to learn it. But if you don't understand the people you're actually looking after and what's going on in their lives, well, obviously we speak about stress, trauma, but there's also other stresses in life that build up. They continually build up, and you're trying to get through life unscathed as you can, and it takes a lot of time.
It does.
And the way to really, you know, to look at the low hanging fruit and where do you start? You start by normalizing the language, because let's face it, you know, we hear time and time again about the barriers as to why mental health. It's almost like the elephant in the room, because organisation and senior leaders don't really want to scratch the scab off the sore, because they know that it might bleed and bleed profusely. So, you know, understanding the workplace social determinants, looking at the stigma, the prejudice, the discrimination, the fear, the shame, the distrust, that's what goes through the minds of people. And they're the things that stop people from wanting to seek support. But that also, conversely, is what puts fear into leaders, because having to deal with someone's most, you know, core and personal issues is something that, as you rightly said, Paul, that leaders aren't trained on. So you change the language and you normalize the language. Someone comes to work with a cast on their arm, everyone can see it. You know, what can I do? Can I get you a cup of tea? Do I need to help? You go on some restricted duty, etc., etc. You come in with you possess a mental health issue or an illness, and it's stuck in here. No one can see it, and the only way they can see it is through behaviours or lack of behaviours. And sure, we're not psychologists. Most people aren't in that space, but to understand, and that's that empathy element where you understand and you know the person that you're working with or who works for you, and you see those initial changes, and that's the first part. And where organisations enable that and allow that, that's the first start of being able to build that mentally safe culture.
Yeah, and I think actually it comes down to that. It's like even any relationship, could be with your partner, could be your friends, your families, even within an organisation, building that safe place where you can discuss things openly without judgment, and that know that you're going to get some help. I think it's very important for someone to feel safe, because if you don't feel safe, you're not going to talk. There's obviously that stigma in the background. You think, oh, my job's going to be going soon because I've talked up about my mental health issue. So changing how we look at that is very important.
Yeah, and there's some basic tools. I mean, mental health first aid is amazing. It's fantastic. You get so much information from a basic 2-day mental health first aid program. I don't really understand why organisations that are putting people on the front line don't ask their recruits to have a mental health first aid training certificate before they join, because it just gives you all the basic understanding about what different mental health issues are, not only in yourself, but how to identify them in other people, and then how to actually use the language around that when you're talking to people about asking them, are they okay? It's just I think it's a basic requirement, to be honest. And we could probably roll that out in organisations now, especially for people that are working in areas of peer support, to have that basic knowledge, just to understand the language around it and how to open a conversation to get it going.
I think it's a game changer. Like, I think people should be trained up in mental first aid as a recruiter, or they're coming into a new organisation, and just having that basic skill that you can spot your colleague that you might be struggling through things, and be able to assist in speaking up. But it's not going to. There's plenty of mental health, trainers out there, providers that can actually assist in this area, and it wouldn't take too much investment to get that implemented in different organisations. And also, then we discussed about the importance of self-care amongst our leaders. If we're already making sure that our people are trained up in mental first aid from the start, they've already got that background, so they understand about self-care already. And
so. And it's like a ripple effect. The more that are trained in that area, that it'll just work its way up. In years to come, those people are going to be leaders, so they'll already have that basic understanding. And maybe by then, there'll be some other more advanced courses that they can do to upskill themselves.
Exactly. And you look at the volunteers. Obviously, they're not always, being a volunteer, they get called out. But look at what about their leadership and how are they looking after their mental health and looking after the volunteers that currently work for all those organisations, and getting access to, appropriate treatments. They're still struggling in those areas.
Yeah.
So I was also going to ask about what do you think about lived experience in these roles? There's obviously a lot of lived experience coming into leadership roles now. But now they're starting to tend to fall down a bit because they're not looking after their own mental health, and the pressures of having that attachment or that label of lived experience. They're obviously categorized into different areas now, and how they get jobs and how they're paid. So
I've seen officers go back to work with lived experience of mental health that have been actually on workers' comp, with the right help and assistance and support, and responsibility, taking on responsibility themselves, because let's face it, if you don't take responsibility for your own mental health, no one's going to do it for you. But with a combination of all of that, actually being able to go back to work, and such a great commitment to bringing mental health into the forefront with their colleagues, and actually speaking to management about implementing programs, because they've lived it and they've shown that just because you have had a mental health issue doesn't mean that your career is over. I mean, if you catch it early enough at the point where it's burnout or compassion fatigue, rather than the diagnosis of PTS, you've got far more chance of being able to go back. I mean, even with the PTS diagnosis, I mean, I've got lived experience of that, and I've gone into work, full-time work, years and years ago, and I've been able to achieve at a higher level. It's just about management.
Exactly. That's what it comes down
yeah.
to. Management.
Yeah,
Personal
but
management.
it can be done.
Yeah, definitely. I was going to say, ask about the strategies for embedding mental health considerations for organisational DNA. How do we start to implement this into organisations? How do we start changing people's DNA on how they perceive mental health in leadership?
Well, first of all, it's up to the organisation to actually start that. I mean, it's not going to happen by osmosis, and it's a challenge because all of us really, unless you're at the top of the pyramid, you can only influence what you can when you can. But there's nothing wrong with doing that and starting that. But to go to your question in changing the DNA organisation, it has to be an holistic systems-based process. It doesn't start, with a message from the CEO or the commissioner or whoever coming down, because we know that doesn't work. That's basically a read, a delete, and go on. That's the start. It's got to come from the bottom up as well. And as we know in leadership, some of the greatest ideas come from those that are at the coalface, not necessarily those that are sitting in the rarefied air of senior leadership. But from my experience, where I've seen success is where organisations have engaged and consulted, with their workforce, and done it in such a way where it is done anonymously, so there's no fear of retribution, etc. And the people will tell you what they want and how much they want. But it's also, imperative that the leader actually starts by doing that. And we heard, I think, Esther, you mentioned earlier, or Paul, about leading from the top. But leading from the top doesn't necessarily mean that you have to tell the world about your own personal story. Certainly, lived experience is great, and I found myself in talking about my lived experience that gave tacit approval for people to want to talk about theirs or share their stories and things like that. But if you don't have an organisation that has those governance structures in place where it makes it safe for people to do that, that won't happen. And I use my own model. I call it a socio-ecological model, because it doesn't just sit within the organisation. It goes more broader than that. It goes more broader to the family, to the community. It goes to, for instance, the board, or whoever the people are that are responsible for that organisation, for government, for elected officials, etc. So if you start to construct that, and that filters through. So basically, it's okay to take a mental health day. It's okay for somebody to come to work and go, you know what? It's okay for me to say I'm not feeling okay today. And then you have those processes and structures around that, but also recognising that the organisation can't do everything. And this whole idea of wanting to keep it insular, having the people there that are there, people in the workforce, that the peer support groups and things like that, that's great. But there are a lot of folks that would prefer to go outside that. And having that ability and being brave enough to be able to go, you know what, if you're not feeling well, we have this within the organisation, but also feel free to go here, and there.
I think that's what it comes down to, because no one likes being told what to do. If we can start providing people with so many options, they can, by self-empowerment, to go, I'm going to do this. And then they look back at themselves and go, I did it. No one told me I could do it. And that just empowers people to achieve a lot more, because they've actually made that choice, and just having that choice to actually do something about it.
I think that's so true, because like a lot of if it's a service or a government organisation, you're often told when to come to work, what to wear, when you're going to have a meal if you get one, when you go on annual leave. I mean, all these things are done for you. So the mindset of expecting someone to actually pick it up and show you what to do, or guide you in the right direction, it's not going to happen. Because there's also still that stigma around even talking about it. So I guess that's really where, empowering people to take that responsibility and go search. There's so much you can find on the computer if you start searching Google about mental health in each particular organisation that you might be working in. And there are organisations outside of the services that can actually support and, give advice and referrals and that sort of thing. So there's always that other option as well.
Yeah, there's a lot of resources out there that can help a lot of people in different ways. And a lot of organisations are doing amazing things in this area. But as I was saying before, like the generational shift now towards mental health is so critical that we need to start putting it into early intervention, because it's going to be a lot easier to catch something at the start before it, festers on to down the track. So getting that training from the start, as I said, like training in mental health, first aid would be perfect for getting people in a recruitment level phase, so they know they come into an organisation, they know how to look after their own people and look after themselves. But also, training in what's going to happen after I finish my role. What was my job going to be when I look down the track? And you talk about identity and your expectation, your purpose. Do my expectations meet the company's expectations or mine? Because initially, when you go into a role, you have an expectation of what this role may perceive. And then as you perceive down the years, your expectations starting to change. And then you're looking at your purpose. And well, my purpose was to say, assist people and help them save their lives. But now I'm just trying to survive by my mental health, my stress. I'm going through all these issues, but I can't do my job anymore. So then you start losing direction. And then
I agree. And like just giving them some we talk about recruitment level, and I've heard so many times over and over, especially when I was working in the area, we don't need to talk to recruits about this, because they don't need to know. It's not going to, it's not going to affect them at this point, but it does, because if they understand the neuroscience behind trauma in the brain and how that affects the body, just in the body systems, your heart rate, your how it affects your blood pressure, and it can affect your skin if you're getting, rashes, or you're not sleeping well, or your digestive system's not working properly. Basic understanding about that at recruitment level gives you the ability to actually pinpoint, well, I'm not actually doing too well at the moment because I've got gut issues, or I'm not sleeping very well. Just little telltale signs. To give you some idea that you need to actually correct that. You need to start doing some things that might help yourself to, get back on track before it gets worse. So just little things like that. I think that we do need to really start earlier, much earlier than we are, with talking about it.
Yeah, and totally agree. It needs to actually go into pre-screening, and I say pre-screening not to screen people out, pre-screening, and to provide them with the information and the comfort that they need to know what they need to do, depending on which area that they're working in. But many leaders think it's a linear process. It either starts with the CEO or what have you, and go. It's far from a linear process. It needs to be looked at from a multivectorial process. One of the simple ways I've seen to do it is to have it in an annual performance appraisal, or 6 monthly appraisal. Really, it becomes one of those core elements. So what are you doing to look after yourself, but what are you doing to help others look after? That's a buy-in that you do, and that's a great way to start the process, while at the same time you start to build those structures and what's needed, but also too to look for those folks with the lived experience and those champions that the organisation can use. Because the more that you have folk like that talking, the more that gives people comfort to say, well, okay, well, especially if it's someone in a leadership role, if they're talking about it and they've gone through it, well, I feel okay to do that. And then you have that richness of resources. And I use the notion of capacity building as opposed to the education or whatever, because it forms part of that. Organisations don't want to hear capacity building, because that, in their mind, means, well, clearly we don't have the capacity to do that, so it's looked as a negative. But whenever you want to institute far-reaching change, and especially in leadership, it's got to be that capacity building where you're actually giving people that capacity, and training's a part of that, and you allow that to build and that to germinate. And it's the holding of focus groups. It's doing all those things that a lot of organisations don't like to do, because it takes it away from the core business. But let's face it, like I said, if you don't look after the people are going to fall over. And it's expensive. And now, these days too, I mean, there's legislation now. You talk about the occupational, health of people, and the legislation changes where the onus is on the individual, not on the organisation anymore. So there are elements of that where, leaders ought to be thinking about, what if someone under my stewardship, suffers a breakdown or depression, or hopefully not goes through and takes their life by suicide? what could I have done better? What didn't I do? Or I did nothing, and the onus is on me.
Exactly. And you can look at it as well. It's like people say, yeah, I look after my mental health, look after myself. It's like, well, how? How do you actually do that? What does that look like? And break it down and say, well, what are you doing to look after it? Because obviously you can ask a lot of questions, people saying, yeah, I look after myself, I do certain things. It's like, well, what do you actually do? Break it down and see if this is, if it's working for you. And you've got to evaluate it as well, because you might be doing something that you think you're doing, but you're still getting worse by the day.
Yeah, and that's highly individual, because there's no one size fits all. As there's no one size fits all, within the leadership mindset. It's highly individual, and because it's highly individual, and there's no one size fits all in terms of treatment, and you see that often in organisations where they look at it as a one size fits all. But what the organisation's responsibility is to provide the information, to provide what needs to be done, offer people opportunities to do things that are positive for their mental health, and then let them take what they feel that they need to be able to help with themselves. Conversely, as well, for the leaders, provide that information on, how do you engage with someone? And I love the notion of, are you okay? That's great. We do it one day a year, but it needs to be done every day. But then what happens if you're a senior leader and someone comes to you and decides, I'm going to confess to you all my issues? When somebody makes that decision to open up about having, a mental health injury or a mental health condition, it's like standing naked in the middle of the city. Whatever that person says is going to profoundly impact that individual. If it's positive, it'll be great. The one word or one poor use of language, and I know in my you're shut down. They move, they get embarrassed, but you'll never get them back. So it's almost like that cliff situation where leaders need to be aware and understand of what's right to say, what's not right to say, but more importantly, and that's why we got 2 ears and 1 mouth, to listen.
Yeah. And that's
often that's what people want. They just want to be heard.
Like capacity building, like as you're saying, like having a community approach to in your leaders and training them all up, like get them all together and start discussing things. So this is how we should be looking after our people. Because someone, as you said, someone might come up to you one day and start, opening up. So this is what's happening with me. And if you're not actually listening properly, you can say something that's really going to affect them.
Listening is a skill as well. It's not a skill that everybody has. I mean, someone could be talking to you and you're thinking about, what you're going to answer, how you're going to answer that. And I've had to really work on that over the years to actually, and pull myself up that I'm actually not listening. I'm not getting all of what I need to hear here. So sometimes saying nothing is actually better, because the person just really needs to be heard. And that person-centered care is so important. A few years ago, there was a lot of apps, sort of going around, and a lot of, online sort of stuff. But people just want to be heard. We're meant to live in community. We're not meant to live in isolation. And, that actual community and just being together and actually listening is a really strong component of being a good leader.
Yeah. And also, also, I believe we've somewhat lost the art of knowing who we work with. We're all so busy trying to do what we need to do to fulfill our obligations. But if you know your staff, and what you as a great leader will understand when something's wrong. And I use an example many years ago where there was a woman that worked for me, and I could tell that, and I wasn't trained in this, I just noticed that she was normally very gregarious, outgoing, but over a period of time, she was regressing. And I just said to her one day, hey, you're not yourself. Is everything all right?
Yeah. And
what it was that her dog had become ill and had gotten cancer, and over months had deteriorated and eventually died. And I'm very open about this. I had a little bird on this side going, well, that's okay, just buy another one. You'll be fine. And then I had one on this side, hey, okay, well, she had no kids. This was her life. This meant everything to her. So that what happened in the home moved into the workplace. And yet it'd be so easy to dismiss it, to say, well, you're not performing, you're not doing your work, you've slacked off, you're going to get punished for it. Yeah. And we move away from that. And as you rightly say, Paul, as millennials and as the Gen Zs come into the workplace, they're very much focused about this. And if they don't like what they see, they'll leave.
Exactly right. And
organisations have lost a shitload of money training those people, onboarding them, getting them in. And just on that topic, we don't do any offboarding either. You know, you work for an organisation for 30 years, organisation spends hundreds of thousands of dollars on training you, and depending on where you are, and I guess we could talk back to the first responder, medical, police, and whatever the day you leave, it's just like sign these papers, give us everything back, goodbye.
Yeah,
you're expected.
Yeah, you're not come back into civilian life. You haven't been desensitized. Like, you're still acting like you're in that role.
Yeah.
And it comes down to families as well. Like, families don't have enough support in this area, because obviously, as a person opening up to obviously their leader about what's going on, families don't have that opportunity. They're stuck at home and they're waiting for that partner to come home and start dealing with it all again, and they don't have enough information in how they should be looking after each other.
No, and often, and I refer to the family as the canary in the coal mine, if people are aware of that euphemism, where they see the slow burn from the start, and a lot don't know where to go, because they don't have that. If there is an ability in an organisation to provide that, they don't have that resource, and they see it. And often they'll be, if they do discuss it with their partner, it usually often can lead into some robust argument and being told, leave it, nothing to do with you, let go. And then you start to have the disintegration of the family and the loved one sphere. And that's not fair, especially if it's something at work that is causing that. But it doesn't have to be. It could be something in the household or the home as well. Yeah. Exactly
right. And like, it's a life, things aren't for free, but how do we look at, the economic barriers to mental health in this area? Their return on investments. Like, obviously we put a lot of investment into our people and how they, do their roles and that, and then we're missing out on a vital part of actually achieving with their mental health.
Well, what happens with that, Paul, is an organisation makes a decision. Yes, we're going to make mental health a priority. We institute a whole lot of things, and there it stays.
Yeah.
As we've seen in the last 5 years, the whole paradigm of mental health has shifted significantly. So it's a movable feast, and it's not static. And it does have to have that. It has to have that ability to be able to, to assess, to be able to redesign, to be able to refocus. But many organisations don't do that.
Yeah.
Even if that is if they have something in place.
I agree.
Yeah, I do too. I mean, a lot of the time they want to do it themselves, and they don't have the training. I mean, you wouldn't get someone to, run something that has no expertise in that area at all. But unfortunately, some of these services just prefer to do all of it themselves. And sometimes you've got to outsource. I mean, you just got to find, people that have expertise in the area and bring them in. And you can do that quite successfully. It doesn't have to be done in-house.
It can't historically sit in a HR area, which it has. If it sits in a HR area, what message is that sending to people? Oh, it sits within HR. If I declare I've got a problem, it's an HR issue. There you go. I've lost my job, or I get moved, or what have you.
Yeah.
I was just going to go into some Q&A. We've got some questions popped up on the screen. Where do you think the role models we can find for this in this area? A good one.
That's a really good one. Yeah, there are many really good role models out there. I think it's just a matter of finding them. There's a lot of leaders out there that are so passionate. I've been to quite a few conferences over the last couple of years, and I'm really pleasantly surprised to hear a lot of leaders actually speaking about leadership and mental health. It's really refreshing. So I think you've just got to source them out. They are there.
It's right. It comes down to investment rather than reaction. Yeah, most organisations react, not invest. And if you invest, and you might have to put your hand in a pocket. I mean, you could go to any of the speaking circuit businesses, and there's a million people out there that are good role models that will talk about that. But look within your organisation first. There's nothing better than having someone who people know, or someone who people are comfortable with because they're living in the organisation.
Yeah.
And that they may want to do it. There's one organisation, I won't say where, but what they do, you walk into their lobby, and many lobbies these days have television screens where they put up what they do and what have you. They have one person every week that talks about the impact of mental health that they've had on them, and that can be anything. It doesn't have to be just a first responder, military, etc. But what that does is that it shows everybody that the organisation is committed to it. but it also shows that the people are comfortable in talking about it, explaining their situation, and that builds hope.
Yeah, it definitely does. And looking at culture and organisational change, how do we start looking after these people that are important to us?
Well, yes,
you go, Esther. I talk too much.
Just asking them what's happening with you rather than what's wrong with you.
Yeah.
You know, get them in and have that person-centered discussion. Talk to them. Listen.
Yeah.
That's the first step.
Yeah, and obviously
understanding that culture, Paul. I mean, when I started my work journey, I didn't know anything about culture. You just go into work and you just do what you do. But every profession has a culture, and you have to understand that culture because you need to use that culture. And there are positives and negatives with the culture, but you have to use the positives in that to be able to move and to get things happening. But you have to understand the negatives, because the negatives will be the barriers in terms of, and we all know in every organisation, we know that there's that one person or those group of people that, FTW, that negative. They're the minority. We work on the positivity of it. If you know the culture and you know how to navigate that, you know how to embrace that and talk about it. It doesn't have to be the elephant in the room.
Mm-hmm.
I think the culture thing is important too, because if you're going to run some programs, even a mental health first aid program, you've got to have people that understand the language and the culture. There was an organisation a few years ago that decided to do mental health first aid training, but they brought in a young female trainer who had no understanding of the organisation or the culture whatsoever. And they all sat there with their arms folded. And halfway through the day, she just couldn't continue, because you've got to be able to reach the group. You've got to have them leaning forward into what you're saying, what you're telling them, what you're trying to, educate them on, rather than sitting back with their arms folded and having the attitude, this is a load of crap. It's got to be culturally sensitive, and the language has to be suitable to the actual organisation.
Yeah. Storytelling. Storytelling is everybody loves a story. I mean, God, we watch it on TV every night, with whatever the multitude of lifestyle shows are on. But if someone can tell a story, and not necessarily, preferably a non-fictional story about your own life or about something that's experienced, in my experience, that's where people get the buy-in, because it's real. You can see it, you can touch it.
Analogies are good, Yeah.
I was going to say, we've got another question. How can we put a positive wording out instead of a negative stigma of mental health? How do we change that? How do we change the narrative on? That's
why I think that's a really important topic for me. And I keep sort of going on about that, asking people what's happening in your life. It's just softening the language around the discussion when it opens, rather than, well, what's wrong with you? Like, why aren't you, performing, or why have you had so many days off sick, or why aren't you getting that workload done as quickly as I'd like it? It's just the language around it and softening the discussion.
Yeah. I just had another great question. Having a place of supportive and understanding around people who are neurodiversive, and how the organisation will support them, and how can it change mental health of that person by looking at that person differently?
Maybe finding champions that can assist that person, people that have like mind. That getting a core group of people that have all different backgrounds and expertise that you can call on when you require, the help that they can give.
Yeah, I was just going to say, we look at people training up our leadership in mental health. How do we evaluate that? How do we evaluate that someone's they've been trained up with their mental health now, they understand the language, and how do we evaluate them in that role now to their organisations?
In answering that, can I just go back to the previous one?
Mm-hmm.
What we have to really appreciate is that our workplace is diverse, and we have to acknowledge that. So we have to look at all the various elements, through disability, through neurodivergence, gay and lesbian, Indigenous people from other countries, because you can't have the one size fits all apply to all of them. It has to be. It doesn't. It can't be as strict as that. But in terms of the evaluation comes in many, many ways. I mean, we've seen many organisations do a what's it called, they do an annual evaluation on the happiness of the workforce and things like that. Often they're skewed in their statistics, because you'll either get a bunch of disgruntled people filling it out, or maybe a bunch of people that are good. But where the real evaluation comes for me is in that data that sits aside that. So the number of work days that are missed by people, the insurance premiums dropping, tangible things like that give you a great evaluation. That's good, but it comes back to the happiness of the organisation. You're never going to get 100%, well, unless you're a Microsoft or a Google or something like that, because they can do what they can do outside of what many can do. Yeah. But general, and it's also hard because many organisations and leaders get nervous when they put out those surveys every year, because it often means a lot of work. And if that survey becomes public, and we see that it becomes public, it makes an organisation, very nervous and less likely to be open and transparent in what they do. But what you have to also acknowledge is they're going to make mistakes, and be honest when a mistake is made. Don't try and cover it. Don't try and deflect it. And if, like I said earlier, if you make the mental health cascade through the whole of the organisation, it will work. Mm-hmm. But again, it's got to be not only top down, it's got to be bottom up, it's got to come from the sides, and it has to run concurrently. It just doesn't go through a linear process. No. And by adjusting every year, you adjust it, you tweak it, learn based on what you learn, from that information that you get. That shows people that organisations and leaders have truly bought into the process, and that's what shifts that DNA, where it becomes part of the DNA's organisation, where you no longer have to go through these processes, because they're embedded. They're structurally embedded throughout the organisation.
Unless you can have that research and data to back up, your mental health leadership roles, then that what's actually working, what's not working.
Yeah, I think to add to that, just ask the troops.
Exactly.
Just ask the troops. Like, how am I going?
Yeah.
You hear, that's when you're going to get honesty.
Yeah. Yeah. And as I said, like, obviously they look at leadership and they say, obviously, it depends on respect, integrity. I think it's empathy, trustworthy, and honesty. But I think we need to add a few more things into our leadership and how we look at that. And specifically with mental health, it needs to change a lot in those roles. And not everyone's a good leader. But I know
flexibility is a big one.
Yeah.
You have to be flexible.
Adapt. And like people, as I said, look, people are diverse. We've got this huge population of diverse people. We need to be able to adapt, change our communication, be able to listen to people and actually care about them. Because without people, we don't have organisations. It just comes plain and simple as that. Mm. So I have another question. In regards to doing mental health courses, obviously there might be a rush on organisations to go do a mental health course, but who's actually going to be the leadership in these roles? Are they just going to be covering all their bases that we've just done a mental health course? And as I said before, like how do we get value out of that?
Well, I think that's why you've got to evaluate those courses, and you've got to bring them back and evaluate, maybe do a refresher in 6 months' time and find out whether the people that have done the program are actually still using the tools and strategies that they've learned. I mean, that's the real decider when people actually say, well, I did that program 6 months ago. And here's a few examples of where I was in a really high stress, critical incident situation, and I was able to breathe into it and calm myself and do the job the way that I needed to do it. And afterwards, I didn't feel like I was burnt out. I felt like I could go home and, relax and bring my nervous system down to a nice, even state. So just basic stuff like that, finding out what is working and what's not working. And if the programs that they're running are working, keep running them. If they're not, go on and find something else. There's plenty out there.
Yeah. And obviously a lot of people belong to unions and associations. How do you think you see them in this area as well in regards to mental health leadership?
Unions have a really big role to play in this. They really do. And because they're the ones that can actually push change. Yeah. So I think that we should really look towards the unions to to stand up, and they are. I mean, I'm seeing this across the nation, especially with police unions. They are standing up, and they are demanding more training and resources around it. So, because obviously the unions are so concerned about retention, and mental health's a big topic in retention.
But unions are also funded outside of normal funding streams too. And there's no reason why they can't actually institute that, and they can't push that, through their unions as well. Because it's a win-win. I know some do, not all. Yeah.
Some of them have actually got counselling services and peer-to-peer services, and they have organisers that will go out to homes and visit when things are really not working well. So some are doing a lot better than others, though. So there's still a long way to go. But yeah, I think the role of unions is vital.
Yeah, I think it's just get everyone around to actually assist in the area, because obviously everyone's trying to do the best thing by all their people. And so getting unions involved, I think it'd be very important to get the investment in the area as well. So
and all of this leads to a return on investment, Paul, because you've got to put the money at the front to be able to gain the investment in the back. And if you don't, and I know many organisations have to shift money around. There's limited budgets, and something has to go to be able to fund something else. And that's a discussion for each and individual organisation. But what price do you put on the well-being and health of your people? That's really the question you've got to ask yourselves. That leaders have to ask themselves, I should say.
Yeah, and I think it's bringing families into that area as well. It's not just the people who are working for these organisations; it's the families as well, and getting that team building, just having as you were saying before, as having activities and bringing families involved with organisations, so they know how to look after their people is very important.
One of the things that the Police Federation of Australia have done through Proceeds of Crime, and it's just an initiative that I was working on. I'm not working there anymore. I'm just sort of volunteering now because the grant has finished. But is a website, a national repository of mental health information called Police Care Australia, and other organisations can follow that lead, because what I've done is I've actually put on all of the resources there. So any organisation that might be of assistance to police across the nation, either serving former or their family members or friends, along with, there was a counselling service through that at one stage, but as I said, the funding's term's finished. But having those resources in one spot for people to actually find out information. There's a lot of articles that I wrote that were culturally sensitive about policing. So any organisation could do a similar thing and write these articles about PTSD, what's vicarious trauma, what's burnout, all these sorts of things, address the situation of suicidal thoughts or attempts. Sometimes that's the elephant in the room too. People don't want to talk about it, but we need to talk about it. So giving those resources for people to actually research in their own home is really important. And, I think that's something that the Police Federation should be congratulated for, because they actually really wanted to provide that, to at least have those resources available. If someone's looking for help with their children, they've got, children that are suffering a certain issue, they can go on there and find organisations that can help children. It doesn't just necessarily have to be police, but, that sort of thing. I think there's just so many levels to helping people get the right information that,
Okay. I was just going to ask one more question. In regards to mental health and leadership, what's the first action that we should take in this area?
When you say we, as individuals, organisations,
as a collective approach.
Well, my opinion is if you're in an organisation where you're not comfortable with what's happening, be brave. I always challenge people, step up, because if no one steps up, nothing happens. Start to gain that knowledge that you need to gain. Start to acquire the information that you need to do. And if you are a leader, and it doesn't matter what level you are, there's no reason why you can't start instituting things with your own teams, or your own people, I should say, and teams, depending on where you are. But make it known to the organisation, and make it as a part of your growth. And if you are a leader or an aspiring leader, these are one of the things. I mean, there are so many leadership programs where people are asked to write something or prepare something, whatever it might be. Why not take this as the challenge and say, well, I want to start to change my organisation. I want to start to get that happening, and challenge yourself. And you got to do that brave and ironically fearless thing that you've got to do. Sometimes you got to you know, you've got to say some harsh things to get things happening.
Yeah,
I
exactly.
agree, Grant. It's advocating, putting, during my career, I've had to be careful not to stick my head up too high because it might get cut off. But advocating is always the way to go. Like if you can just get a little bit in the door and sort of start to open stuff up and advocate for some change. Maybe start a reference group. Get a community together of people, and some might be your troops, some might be some of your leaders. Get a few people together that have some passion about it. Start having a meeting, once a week or whatever, and start talking about what can we do in this particular area that we're working in to start to change and advocate for people that might be coming through behind us.
Yeah. One of the best ways that I've seen that is using the soft approach. People have after work drinks or happy hours or what have you. Have someone talk for 10 minutes at a happy hour.
Yeah, exactly.
That's when people's guards are down, I guess. And I'm not saying because of alcohol use and things like that they're in a relaxed state. There's no threat. It's not something, and it doesn't have to be long. And you start that process and you get people talking, and it's amazing once you do that, how many people start to come out and want to tell you about their own things. And then you start to build that collective of those people that want to make change.
Yeah. I think it's just getting those happy, productive workplaces that, you feel safe, you can speak up. You believe in your leadership's got your back, and productivity is going to go through the roof. And also you're going to get your attrition rate's going to drop. People are going to start staying at work because they feel safe, supported and trusted, and they've got support.
And people want to join that organisation.
Exactly. And that's what you want. You want people to join. I just want to thank you both for today. Obviously, we just got to 1 o'clock. We could be talking on this topic for a long time. Thank you for all the information you provide for the webinar. Thank you for everyone watching today. I hope you got something out of it. I'll follow up with the Q&A questions at a later stage, and I'll see if I can get them back out onto the website at some stage. Well, thank you, Esther, and thank you, Grant, for today.
Thanks, Paul.
Thanks, Paul.
All right, thank you.